Good morning, everyone. I'm David Haubert, Mayor of Dublin, and thank you for joining us today for this morning for our series of back-to-back virtual community meetings and community conversations. We are glad that you are able to join us, and we have an action-packed day, information-packed day ahead of us as we explore all of the information that's come about COVID-19, the COVID-19 pandemic, and how the county and our community here in Dublin are responding. Now, here's how today's conversations will take place. We will have three back-to-back virtual conversations. The first one will be a public health update. And here we will be joined with the Alameda County Director of Public Health, Kimi Watkins-Tartt. And from the Stanford Valley Care Hospital, CEO Rick Shumway, they'll be giving us an overview from the Alameda County COVID-19 situation perspective. Next, the City of Dublin Police Chief Garrett Holmes and the City Manager Linda Smith will provide an overview of the enforcement activities and the city's efforts to make sure that we keep safe. We'll receive questions. We have already received questions from many of you. We'll attempt to get through as many of those questions as possible before 10:45. Our second community conversation will be at 11:30. We'll return with updates from the Dublin Unified School District, where we will have our guest, Superintendent David Markin. City Manager Linda Smith and Chief Holmes will return again with information about the enforcement shelter-in-place order. Again, many of you have submitted questions. We will get to as many of those as we can. Finally, at 1 o'clock, we will provide the City of Dublin's Economic Development Update. Economic Development Director Hazel Weatherford will be here along with the Dublin Chamber of Commerce Executive Director Inga Houston, and providing information on how Dublin businesses are faring during this trying time. We'll also be joined by representatives from the Small Business Administration and the Alameda County Small Business Development Center. Again, we will have questions and answers at the end of that session. So let's get started. I'm honored and pleased to introduce to you our first guest speaker, the Alameda County Director of Public Health, Ms. Kimi Watkins-Tartt. Ms. Watkins-Tartt, thank you for joining us, and we look forward to your update on the COVID-19 situation around Alameda County.
Thank you, Mayor. Thank you all for supporting your community at a time when we're really working together to keep our families, friends, and neighbors healthy and, unfortunately, apart from each other. As of April 8th, we have 674 positive cases, 640 Alameda County and 34 for the city of Berkeley, and 16 deaths within the Alameda County borders. While it's not 100% perfect number, since labs only started reporting both positive and negative tests since the health officer order issued on March 24th. But as of April 6th, we have evidence of 6,750 Alameda County residents that were tested for COVID-19. Hospital surge planning continues to be a top priority for us, and we're working with our local providers as well as the state of California. We have been continuously monitoring hospital and emergency response capacity. Our 911 call volume is down still. Hospital occupancy is down. We are filling resource requests for supplies, including PPE, and we're working on predictive modeling, critical care expansion, and regional coordination. On the homeless front, we're continuing to accept guests at the emergency hotels that have been set up. Both hotels are now up and running, and we have guests at both of them. They are in Oakland, and they accept people from throughout the county. Referrals are by agency only, but the agencies that are allowed to refer at this time, there are 168 agencies countywide who can refer to those hotels. Information about that is on our website. Operation Comfort serves people who are homeless and tested positive for COVID-19 or are experiencing symptoms of COVID-19 and or have been exposed to COVID-19. Operation Safer Ground, the second hotel, serves people who are homeless and over 65 or otherwise at high risk or medically fragile, or both. Wraparound support services are being provided by abode services, and nursing services are being provided by our public health department. We've also made some improvements to our website with regular situation updates. Our dashboard is now live, so everyone can see the numbers. The dashboard includes city level data, and we plan to add various data elements, including race ethnicity, as we move forward. And we expect the race ethnicity data to be available by the end of the week, tomorrow. We have early signs that Bay Area shelter in place order is working to flatten the curve. There has been a 40% reduction in physical movement across the county. This is encouraging, and we need to do more to ensure that we have sufficient critical care resources to meet the expected surge in the demand. For example, if that 40% reduction in physical movement went down to 10%, the number of expected hospitalized COVID patients will triple. Conservative modeling shows that an additional 3,000 hospital beds will be needed in Alameda County at our COVID peak, and planning is well underway to meet that goal. The modeling will be updated regularly, and it is an iterative process with our planning processes. We also issued a blanket isolation and quarantine last Friday. This means that anyone who tests positive for COVID-19 at this point and their close household contacts will receive standardized isolation and quarantine instructions from their healthcare provider. Having this order in place will help our disease containment workflows within the public health department and reinforce the critical importance of social distancing. Long-term care facilities are our highest disease containment providers at this time. We have formed an internal task force that is dedicated to reducing and mitigating outbreaks in long-term care facilities. We've increased the prioritization of those facilities for PPE requests. We're working directly with the providers to support their efforts to protect their staff and their patients. I'll also note that our work in the long-term care facility arena is critical to managing the hospital surge because it helps us reduce hospitalizations. Our best safeguard against COVID-19 is to continue staying home and practicing good health hygiene. If you're an essential worker feeling mildly sick, please stay home. More on the PPE front, resource requests for non-medical personnel, non-medical supplies, and other items specific for COVID-19 should be submitted through our local city's Emergency Operations Center. If the city cannot fill the request, they will escalate that request to the county. EMS provider agencies and healthcare facilities requesting personal protective equipment or medical supplies related to COVID-19 pandemic can complete a form at https://ems.acgov.org/COVID-19. Healthcare facilities and other sites that interact directly or face-to-face with patients are being prioritized for PPE. Options for testing are increasing. If you are symptomatic, the first option is to contact your healthcare provider. Many providers are now able to have testing done at their hospital facilities, so go through the private lab that they normally work with for other lab testing. If your symptoms are not serious enough to be tested by your provider, testing sites in Fremont and Hayward are available and do not require health insurance. More private labs are coming online for testing, and cities are opening their own sites. We're working to ensure the quality of data and communication to appropriate reporting authorities so that all of the testing is consistent. At this time, we know shelter in place is working, and while we're optimistic, we know we can't be complacent at this moment and return to normal too quickly. This would result in a sharp increase in cases and hospitalizations. Thank you.
Thank you, Ms. Watkins-Tartt. We'll now hear from Stanford Health Valley Care, the Rick Shumway. Thank you for joining us, Mr. Shumway.
Yeah, thank you. Thank you for having us on. I'm also joined today by Tracy Lewis Taylor, who's our Chief Operating Officer, and David Speck, who's our Chief Medical Officer. So I appreciate both of them being here, particularly if we have questions at the end. I appreciate Ms. Watkins-Tartt's summary as well. We've certainly been working very closely with the county and also the city and many of the local and other state and federal resources that are at our disposal as we contend with, as we've said, a very unprecedented situation. What I'm going to do just briefly is go over a handful of what I would consider to be highest items of public interest as it relates to how our hospital and health system is responding to, again, a situation that has been singular in really all of our lifetimes. So I wanted to hit these, and I'm gonna put them into buckets. So bear with me as I go through them. The first thing that I want to talk briefly about is the concept of surge planning. So the California Hospital Association, in partnership with the state and the counties and others, has asked all hospitals in the area in the state to be prepared to surge to 40% beyond their highest current capacity. I am proud to say that our teams at Stanford Healthcare Valley Care have worked very, very hard on this, and we certainly are prepared to meet that surge at that level and actually beyond. We have a 5-phase surge plan that we understand very, very clearly what happens at each one of those surge phases. And again, I think our teams are well prepared to execute against each one of those phases. So very, very proud of the teams. And again, it's a really good news story for our community, given the fact that that is where many of those patients would be taken care of in a surge scenario. So the second item I want to talk to you about is sort of related to that. This is around our infrastructure. So one of the things that many of you probably know is that when a COVID patient requires hospitalization, it can mean a number of things. Most COVID patients are intended to be taken care of in a negative pressure room within a hospital environment. This really allows the airflow in the patient care areas to stay isolated and to make sure that that it doesn't exit the area that the patient is in, and thus decreasing the transmission risks to healthcare workers and others. The good news is that over the course of the last 3 to 4 weeks, we have increased our capacity with negative pressure capabilities at the hospital by really like 800%. It has been a 24/7 effort on the part of our facilities and engineering teams, and we have gone from 7 COVID capable rooms to 58 in that short period of time. In addition to the negative pressure needs and capabilities, one of the things that we have to make sure we're able to expand on as part of a surge is our ICU or intensive care capabilities. Those capabilities have also increased substantially over that same period of time. So the good news is from our perspective, we're moving very quickly to ensure that our infrastructure is set up to support a potential surge. We've also incorporated non-traditional healthcare settings into that domain. So things like screening tents and treatment bays that we would take care of patients in the case that we needed to expand outside of our hospital doors. And that's been very positive. Last but not least, on the infrastructure front, we have converted significant portions of our patient interactions to telemedicine. That includes clinic visits, but it also includes interactions even within the hospital itself. So if patients or physicians need to communicate from the emergency department, as an example, with a physician that may be in a different part of the hospital, we've actually put into place telemedicine structures to ensure that we're able to minimize the transmission risk there. So a lot of really good things going on from an infrastructure perspective. Another thing that continues to get a lot of press and publicity is the concept of testing and the expanded testing capabilities. For a hospital in a COVID surge scenario, one of the most important things is that when a test is sent to a lab, the turnaround time on that test is as short as it possibly can be, so that we can then take care of that patient the way that the patient needs to be taken care of. What I'm proud of is that at Stanford, very early on in the outbreak, we actually developed our own internal test to alleviate some of the pressures that were occurring on both county labs and other private labs across the region and the country. And so we very early were able to send all of our screening tests to Palo Alto to ensure that we got a quick turnaround time, and that continues to be a very, very positive thing. We also, as Ms. Watkins-Tartt mentioned, have the drive-through testing sites, 2 in the city of Pleasanton, 1 on the hospital campus and 1 on the campus of our imaging center and cancer center over on Stone Ridge Drive. Again, the protocols there are, if you feel like you have symptoms, to contact your primary care provider. They will take you through an assessment and then make a recommendation about whether or not you should be tested. If you should be tested, they can submit an order to either of those drive-through testing sites, and then you would subsequently utilize that service. We are also working with cities in the Tri-Valley on continuing to work on expanding our testing capabilities, and that will be an ongoing conversation over the course of the next week or 2. Another item that hospitals continue to focus on significantly is PPE. Obviously, as the frontline healthcare providers, or as some of the frontline healthcare providers, this is of utmost importance to us. What I will tell you is that we are very fortunate to have an exceptional supply chain team that continues to turn over every single stone and rock to identify new sources of PPE as we need them to take care of patients now and in a surge scenario. We're very grateful for the work that this team is doing. It's allowed us to continue to provide our providers and our frontline healthcare workers with the protection that they need. And in the end, our baseline, as always, is making sure that we are meeting the standards set forward by the CDC and by the California Department of Public Health. We are constantly monitoring those requirements for personal protective equipment and absolutely meet those standards, and in many cases exceed those standards. So, very grateful for that. I will say, I'll take the opportunity to put in a plug. We are accepting PPE donations that are not homemade. They need to be in packaging original to the manufacturer. But if you have those donations and would like to donate them to your local community hospital, we have a donation site at the Lifestyle RX Gym in Livermore. And so you're more than welcome to participate with us that way. Another item that continues to get a lot of attention is ventilators. Do we have enough ventilators? And again, I will just say we are in a position where our surge planning has allowed us the capacity that we need from a ventilator standpoint to accommodate a surge. So we are in reasonable shape from a ventilator perspective in our community. So very grateful for that. The last thing I'll just share with you before I close is one of the unique pieces of having Stanford Healthcare in your community. We are one of very few sites across the United States that are participating in clinical trials for the treatment of COVID patients. So when a patient is admitted to our hospital with COVID-related symptoms, if they meet criteria for the clinical trial, we would be able to enroll them in the trial. And so again, that's something that's unique and doesn't exist outside of San Francisco and Palo Alto at this moment in time. And so we're very grateful to be able to offer that to our patients in this unprecedented time. The last thing I will leave you with is, I have to say, and I think people that choose to work in the healthcare environment generally are just wired this way, but the way that people are stepping up and preparing and making sure that they are there for you at the time that you need them most is nothing short of inspirational. The teams are just exceptional, well prepared, and looking forward to continuing to take care of you in this particular period of COVID-related issues, but for anything else that you may be experiencing. That's the last thing I will say, is that in the case that you require healthcare, we would ask that you seek healthcare. the county orders are very clear that healthcare providers are able to continue to provide that service. So if you feel like you've got an issue that you need taken care of urgently or emergently, please make sure to know that our hospital is ready to take care of you in that moment. Thank you.
Mr. Shumway and your team, thank you for being on the call. It is clear that you and Ms. Watkins-Tartt are both in good communication and doing what it takes to help keep us safe. Thank you for that update. We'll now turn to our city manager, Ms. Linda Smith, to give us an update on the actions that the City of Dublin is taking. I know you're joined by our police chief, Garrett Holmes, to share with us how we're enforcing the rule of law here in the City of Dublin. Please take it away.
So I'm only going to take a couple of minutes. And before I start, I just want to circle back to Rick really quickly, if I could. Rick, can you clarify for the public, since we have 72 people on the call, you do not need to be a member of Stanford Valley Care to use the mobile testing that's currently available, correct?
So that is correct. If you have, again, if you're a Kaiser patient or have other insurance or otherwise, or just get a physician's order, you are able to use those testing sites based on the physician's order. So please feel free to do that. We work very closely with the physicians within our community. They all know how to submit orders to this site. And so thank you for the clarification.
Great, thank you. Thank you again to the public who are on this call. I know getting information and getting quality information is really important to the community. And what I'm going to do is just briefly give you an overview of what we're doing on a city operational standpoint. The city has made the decision to close all of its facilities with the exception of Dublin Police Services, which the building remains open, but there is going to be some limitations on the number of people who can access that building. The chief can cover that if you'd like, but just know that if you do show up to Dublin Police Services, you may need to wait outside if somebody else is in the building. All of our full-time staff, with the exception of a handful of folks who are trying to make sure we can answer the public's questions, and are working from home. So we do have a couple of staff in the building, even though City Hall is closed. Feel free to call City Hall if you have any questions. Our number is 925-833-6650. We're the first point of contact for you if you have questions, and we can direct you to Alameda County Public Health or to any other resource that you may need. So please know to call us first and we can direct your calls. You know, this has been a very interesting time for our community and for every community throughout the United States. And, you know, the more we adhere to our shelter in place orders and social distancing, the better off we're all going to be. You know, this has caused us to rethink our operations over the next several weeks, and you know, further guidance from public health will help decide how we proceed moving forward. At this point in time, we've had to cancel basically all of our programming and ensure that we maintain the social distancing and spacing that is necessary to keep this virus from spreading. The city has activated virtually, given the circumstances, our emergency operations center, both command, logistics, and our documentation units and our demobilization units are all operational. Our logistics unit is working with state and local officials on securing housing for vulnerable COVID populations as part of the state's Operation Room Key project. So we're working with local hotels to be able to take in people who have contracted COVID-19 or at risk of doing that or need to be quarantined from the balance of their families. If they cannot be at home, we want to make sure they have a safe place to be. Our demobilization unit is planning for our eventual return to standard operations. That still remains to be seen when that might be. And we're also helping to publicize a request from the county, and they're collecting information from individuals who work in the medical and healthcare settings, and they're looking for those that are willing to work shifts in alternate patient care locations throughout the county. And this is really part of the county's surge planning efforts, which are focused on staffing, supplies, and finding available space. And just in a few seconds, I'll turn it over to Chief Holmes, who'll talk about Dublin Police Services, but I just want to make sure everyone understands that Dublin Police Services is the enforcement arm of the order, the shelter-in-place order. And we've had to adapt because we've had a couple of different orders throughout the last several weeks of our shelter-in-place. And so Chief Holmes and his team are working with our code enforcement staff to ensure compliance with the shelter-in-place order. And as many of you have probably learned, as of the last order, this affects playground areas, playground equipment, other areas where you might be in high contact with other people. So we have closed our tennis courts, our basketball courts, as well as any facility where you can have high touch, and that includes play structures. And then Dublin Police Services is working with the business community to ensure that only those businesses that provide those essential services and are considered essential businesses are operational. I'm going to turn it over to Chief Holmes, if that's okay, Mayor, directly, and have him kind of comment on what their role is in all of this.
Very good. Chief Holmes, take it away.
Good morning, everyone. We're currently operating under the public health order that was issued on March 31st of 2020, and that order is in effect until May 3rd. That's the order that provides the guidance for the sheriff and the chiefs of police to enforce the order within their communities. So far, we've seen a very high compliance rate with both our businesses as well as our residents in the park. And I think that speaks volumes to the numbers that were just released yesterday by city, that Dublin has a very low number comparatively to many other cities. We're continuing to monitor everything throughout the city. Like the city manager said, we are working with code enforcement as well as the economic development team to contact those businesses that meet the essential service guidelines. And that's all I have to report at this time.
Very good. Thank you for being with us, Chief Holmes. You and your team doing a great job. And I guess I would, one question for you is, how are we coordinating efforts with county level officials? You mentioned the Sheriff's Department. We have EOC located here in Dublin. Is there much coordination between the two, or are they very self-sufficient and off by themselves?
Well, I've been meeting a couple times a week with the sheriff and the ACSO command staff, as well as conference calls 3 times a week with all the chiefs of police in Alameda County. And there's also a 4 o'clock meeting in the afternoon for all the EOC emergency managers, and I've been on those calls as well, just to keep apprised of all the latest updates.
Thank you very much. That's great to hear. We'll now go to questions that we have from the community. And again, thank you to everyone for joining us today. Actually, I would like to go back a little bit and clarify a few things myself. And the first one is, we talked about surge workers wanted, people that have special skills that are able to jump in and help out in case of a surge. Ms. Smith, could you tell us, or maybe it's Ms. Watkins-Tartt at the county level, where would people go? Who would they call, or would they send an email to offer their services?
Kimi, do you want to take that, or otherwise I'll have my emergency services coordinator, John Stefanski, answer that question.
Yeah, I think it's better if you answer that question.
Okay, John, can you jump on?
Yeah, so anyone who's interested in that can go onto our website, and under our COVID-19 web page, we have the link to the survey that they're using to sign folks up with.
Excellent. Thank you very much. Anybody with special skills, go to the dublin.ca.gov COVID-19 special web page. I also think I've heard in the general communication throughout the public that this week and next week are especially critical, as experts predict we're reaching the top of the infection curve. Again, a question for our public health experts. Is that truly the case? Is that what we still believe to be the case right now, that this week and next week are really expected to be most critical, or has that changed?
Kimi, can you address that?
For us, you know, the next month really is critical. It's very important that we continue to shelter in place to help keep the surge. We got out in this in our cities and in California to put in place the shelter-in-place orders. And so our numbers in a lot of areas may not look like they look in other places that we may have heard about across the nation. But we want to keep our steady pace, and we want to keep things at bay. The longer this goes on, the more likely it is that we could possibly have more cases if we start to roll back and not practice the social distancing. And so yes, so I would agree, yes, it is critical these upcoming weeks and month or so, because we want to really keep the pace that we have.
Very good. Keep it going. Well said. And then lastly, I want to commend the county for releasing city level data. But I also know that in some sense, the data is not does not have as many examples or data points as needed to really drive statistical, significant, meaningful conclusions from. And so I'd like to make it clear that people should not do that. It's just data. It is important that we release it, but I also know that it was with some reservation. Could you just comment on what people should not take away from the city level data? And again, thank you for providing it, but know that it has its limitations. Is that right?
Yes, it does. As I mentioned earlier, that testing is still somewhat limited. And so although communities are offering more testing services, it's still not what I would call community-wide testing and equitably available to everyone. So when we look at the data, it's not a true picture of all of the people who possibly have COVID. It's a picture of all those people, all the people who have been able to get tested. And so we just have to keep that in our mind. As our testing expands, the data will become more reflective of what the disease burden is, but that is why the shelter-in-place order really does need to be adhered to, because we don't have the capacity yet to test everyone, to know conclusively. And so we all should be operating with the presumption that we could have COVID-19. We could, and so we need to practice the personal hygiene. We need to stay at home. We need to socially distance ourselves or physically distance ourselves from people so that we can keep the positive direction and not have unintended spreading.
Thank you, Ms. Watkins-Tartt. That's great. Stay safe, stay home, and stop the spread. With that, Ms. Smith, we have questions from the community.
We do. And yes, I will. One of the things I'd like to do when structuring these questions, I'm not going to take them as we receive them. I know that Kimi needs to jump off the line in 10 minutes, and I want to be respectful of that. So I'm going to direct the first questions to Kimi, and then we can move on to other questions that we might have received. The first question we received was, would you get COVID-19 if you ate something which had contact with the virus?
From the data that I have seen and the research that I've seen, there is not necessarily evidence of that in terms of the ingesting. But this is still very new. And so we do want to ask people to be, cautious about washing their hands before they put anything in their mouth, particularly those things that might not be cooked, that kind of thing. So if you're picking up fruit, from the store, it would be important that you really wash it well, that you wash your hands before you eat it. But at this point, I don't know of cases of COVID, and we don't have any evidence of it being transmitted that way in terms of food that is cooked and all of that, and then you eat it, other than the fact that someone may have touched it, kind of thing. So
Okay, thank you, Kimi. The next question we have, I might preface it by asking you a question first, Kimi, which is, I know testing kit access is an issue nationally. Can you talk a little bit about what we think that pipeline of testing kits may look like moving forward, or do we have any understanding of what to expect in terms of testing kits that could be provided to the county?
I'll need to get back to you on the details of that. What I will say is that as time goes by, it is becoming easier for us to get access, but we do not have all of the testing materials and test kits in the supply that we would want nationally. And so that is why testing is still limited. But I can get back to you with the details of what that pipeline looks like if you would like.
No problem. So we've been given guidance to wear cloth face coverings when leaving the house. Does this guidance apply to exercise, walking, running, cycling, or only when we're running errands to the stores or around other members of the public?
The guidance applies to any essential service any essential activity that you're engaged in. But I would say that when you are exercising, if you're not around anyone, you're by yourself, that you would not need to have the face covering. And so what we're really talking about is when you're going to the grocery store, when you're going to a financial institution, those kinds of things where you're going to be in contact with other people. We still want you to practice the distancing yourself and making sure that you're not close to others, but you are going to be in a space with other individuals. And so we would prefer and would encourage people to cover. It's not foolproof, it's not 100%, but it will provide some protection if you yourself are actually COVID positive and you don't know it. It prevents you from spreading. And so if we're all covering, then we protect each other in the community.
Thank you. I believe we have one more question related to it, and I guess it's now that the new dashboard is out showing number of cases by city, can you report out how many cases are specifically in Dublin? I looked on the dashboard last night, Kimi, it said 14. Is that still the case, or that hasn't been updated, or gets updated later in the day?
It's updated later in the day. So Dublin is still at 14 as of yesterday.
And I think we're seeking clarification that that number may include the number of cases at Santa Rita Jail. Do you know that to be true?
Yeah, no, it does not. We have a line in the dashboard for Santa Rita Jail, and so their numbers are separated out. So the Dublin numbers only include Dublin residents.
Great, thank you, Kimi. Are there any other questions from the public that would be directed towards public health? Right now, I'm not seeing any. There is a question whether there would be drive-in test sites in Dublin or nearby. I don't think that's questions directed towards the health department. I think that would be directed towards those entities that are trying to stand up testing centers. And maybe this question, Kimi, which is there any plan to provide masks to the entire Dublin population? I think maybe you can speak to the need to preserve PPE for healthcare workers.
Yes, we have no plan to, nor capacity to distribute masks to the entire population. And so we do need to reserve those products, those supplies for certain populations, for medical professionals, healthcare providers.
So we are getting a couple more questions, and then can my kids play with other kids in the neighborhood next door?
If you're able to figure out a way to be socially distanced, I don't know. I have children of my own, and so they're not small anymore, but I would have to say that I would not have been able to figure out how to keep my kids more than 6 feet from each other, and then that's not really playing with kids. So I'd say that's a no, unfortunately.
Okay. Do you have any information on how to sanitize refrigerated products like milk cans?
Milk cans?
Yeah. How should someone treat their groceries when they come in from the from the grocery store?
Right. I think there probably are some good materials on the CDC website, the Centers for Disease Control website about that. But what I will share, what I practice myself is those things that can be washed off. Before I put them in my refrigerator, I do wash them off. So cans, and I've always done this, for cans, before I open them, I wash them off with soap and water before I open the cans. I wash all fruit off that has a skin on it very carefully. And anything that's going in my refrigerator that can be wiped off, washed off, I wash off and wipe off before I put it in the refrigerator. And again, I was doing those things before COVID-19, just because, in the course of inventory and stocking and all of that goes on in a grocery store, a lot of people, those products, a lot of people are touching a lot of things. So
is there any thought at the county level to release information on the locations of those infected with COVID-19 and where they worked? And if that's a concern to the public, for example, grocery stores, things of that nature.
That kind of information, we have no plan to release that.
Okay. All right. I'm just quickly going through this. I know that you have to go real quick. That one, next door, sanitize. Can you give the link to the dashboard again?
The dashboard is actually on the Alameda County acgov.org website. And when you click on the COVID picture, our dashboard will open up.
Great. We received another email question, and there appears to be a homeless man who lives in the area and wondering what temporary housing resources are available for the homeless during this time. Perhaps you can just reiterate the availability of housing for those that don't have current housing, and how they can get connected to those resources. Is that through the county or that through the local agencies, Kimi?
That would be through the local agencies.
Okay. I will pick up that question then in a little bit. Okay. Okay, another question. I understand it is best not to wash your fruits and vegetables with water and soap. Please advise people not to use soap. Is that correct? You would not advise to use soap on your fruits and vegetables? Or do you have any position on that at the county health?
I don't have any position on that.
Okay. All right. With that, I know that's all the time we have with Kimi Watkins. Rick, can you stick around for a couple more minutes so we can ask you a few questions?
Absolutely. Great.
Kimi, thank you so much for participating in this call.
Thank you for having me.
Okay. I think I can direct some of these questions to Rick. Rick, are there going to be any drive-in testing sites in Dublin or nearby? I think you've already indicated the mobile testing sites, the 2 that are currently available in Pleasanton. Can you, again, for the benefit of the people on this call, can you tell them where those locations are one more time?
Absolutely. So the first one is actually on the hospital campus in the back parking lot, kind of back by the helipad. And then the other one is at 5725 West Las Positas, which is about 3/4 of a mile from the hospital, on the back side of our imaging center and cancer center.
Great. Okay. Let's see. The next question is, how many ventilators, and I don't know what this acronym means, maybe you do, Rick, ECMOs are available in total, and how many of them are currently being utilized?
So we do not do ECMO at Valley Care. That would be something that would be done at Stanford Healthcare in Palo Alto. We obviously have a close relationship there and would transfer any patients in need of ECMO. That's for those of you who don't know what that is. That's a complex vascular procedure to manage patients that are having heart and vascular issues. So we don't do that in Pleasanton, but we certainly do in Palo Alto and work closely with the teams there that are monitoring and managing the ECMO capacity daily. What I'll tell you about the ventilators, without getting into specific numbers, is that we are only using about 20% of our current stock. And so we have enough at this point that we believe we'll be able to surge if we need to surge. We're also looking at novel ventilation strategies. So as an example, when you have surgery, you will go into the OR and you'll have an anesthesiologist that will manage your breathing for you during the surgery. Those machines are typically not used for long-term ventilation, but we've identified protocols with our anesthesiologists that we could convert those into ventilation units in the case that they were needed over time. So we're doing okay on ventilators at this point.
To the larger question, I'm just go back on the testing sites for a moment. I know that the cities of Pleasanton, Livermore, and Dublin are working with Stanford Valley Care to ensure that we can increase our testing capacity in this region. We don't know exactly what that looks like. We're still trying to work with Stanford Valley Care on the procurement of additional testing kits. And if we're able to do that through whatever means we can do that, our intent is to do some larger testing in the area. And so that's still a work in progress. And we're hopeful that perhaps in the next several days to a week, we could have more to share with the community on that. This one again for Rick is, it's an interesting question. I'll preface it by saying that. It says, why are doctors sending infected people back into the community? I know of one person who was infected who was sent back and asked to self-quarantine, but his family members are from the same, are not self-quarantine. If the county has resorted to making accommodation, is it the counties, I'm sorry, I'm trying to read this, have resorted to making accommodations in hotels for infected patients? I think I'll start by answering that question. I can't answer the question about the doctors, but I think that the protocols have been that if you are diagnosed with COVID-19 and you do not need to be hospitalized, you are supposed to shelter in place. If you're unable to safely shelter in place at home, I believe that the county and the local agencies are looking for locations where people can be sheltered, including hotels. We are working currently with one of our hotels in Dublin to make sure that those services are available out here in East Alameda County, but those services do exist already in other places in Alameda County where people can be quarantined if they're not able to do it at home. Rick, would you, is that a good way to answer that question?
Great answer. The only addition I would just add for some color commentary is, if you look at the infection rates, as most of you probably know, 85% of people that have COVID-19 as an infection do not require hospitalization. So the majority of people that would be tested by a physician or through a physician's order would likely be sent back home to self-quarantine. And that's why, as we just heard from the county, the quarantine order is so important to ensure that once that's been established, that individual is able to manage that in a controlled environment. So the importance of that is to ensure, again, that we don't overrun the hospital resources, which again account for somewhere in the neighborhood of 15% of overall COVID-related treatment. So the majority of people that have COVID-19 will recover at home, and that's been the protocol since the beginning.
So this is a more general question that, Rick, I'm hopeful you can answer, which is there a condition for a resident to be accepted for testing? For example, fever at a certain temperature, so residents know when to make that call to their doctor to get tested.
Yeah, I think what I'll tell you is the answer is yes. There's an algorithm that gets utilized. So if you call your physician, they will take you through a number of questions. They'll have you take your temperature. And then if you trip, a number of thresholds through that screening process, that's the point at which the doctor would say, yeah, I think it sounds like it's probably a good idea for you to get tested. If you're interested, you don't have to look very far on the internet. Most organizations have put out screening questionnaires, so you're probably pretty safe to look at that. You can certainly refer to the Stanford internet that has information on those screening questions. So you can go to valleycare.com and there's a COVID link, and if you click on that, it'll take you straight to the Stanford Medicine page, so it'll give you more information.
Rick, do you happen to know whether the details or address of your 2 mobile testing centers are available on the Alameda County website?
So they are not. The county is not managing those sites. Most organizations across the Bay Area that are engaged in this are doing so either in partnership with local or regional partners and municipalities, and so they're not being administered through the county. So not to my knowledge. I don't think they're identified on the website.
So I'll just say at this point, if it's not already on our website, John Stefanski, our staff, will be placing that information on our website.
Sure.
Okay, a couple more questions. I don't think any of them are directed to you, Rick. I believe they're directed to police. Chief, are you available or ready to answer a couple questions?
I'm here.
Is mouth covering or masks of some sort enforced by law enforcement, or is that just a strong recommendation?
That's a strong recommendation at this time and make sure that they observe the social distancing.
Okay. There's a question related to, let me just quickly look at this. I apologize because I'm looking at them out of order to make sure we get the questions by person. I believe there was a question related to what the status is on crime in Dublin in relation to what's going on with all the shelter in place. Are we seeing more? Are we seeing less? What's happening with our crime statistics in Dublin during this time?
So overall, our calls for service are down slightly. We have seen a small increase in the area of domestic disturbances as everybody is getting a lot of time together. Overall, other crime stats are slightly lower than they have been over the same time last year.
Okay.
And also, traffic citations are down significantly, and that's due mostly to people staying off the roads and sheltering in place.
Okay. I'll just follow up. We had a comment on the question about the folks going back and self-quarantine in their homes. The question wasn't about hospitalization. It was about the effectiveness of self-quarantine. They know of a family whose child got COVID-19 and they are sent back to self-quarantine, but understand the parents have to go around to do grocery shopping and they've been seen outdoors. That they've read in other countries where you are mandated to go to a hotel to quarantine, so to not knowingly or unknowingly infect the community. I think that was the genesis of that original question. So thank you for clarifying that, Adnan. Okay, let's see. Next question that we have is the farmers market taking place today at Emerald Glen Park? The answer to that question is yes. Last week, the first farmers market was held from 4 to 8. I believe a total of 125 people over a 4-hour period came and shopped. Producers who are at the market are enforcing very strict rules under the new order. No one is allowed in the booth. You're not allowed to touch any produce. The producers are all wearing masks and gloves and are bagging those groceries for you. Any produce that you are selecting, you must maintain 6-foot social distancing between you and anybody else that you're not a member of your own family. So I was out there last week to observe it, and we're making a few minor modifications this week. And if we see more people come out, we can be prepared to address that. But at this point in time, it's really not considered an event like we've been grown accustomed to in Dublin in terms of the activities that we place around the farmers market to get people out and bring them together. The purpose of this farmers market is to provide an alternative location where the community members may not feel safe going into a grocery store, have severe anxiety about being indoors with other people, have an opportunity to shop and select their produce outdoors. And it is deemed as essential under the order that certified farmers market are allowed to operate. And so that's the answer to that question. Any other questions of note? Sorry. And Rick, do you have any information on any of the antibody testing? I know that Stanford is involved in some antibody testing and who might have already had COVID and recovered. Is there any information on that?
Yeah, so that's a very active discussion right now. There's a lot of research that's going on around that, particularly over in Palo Alto. And as that evolves, the other thing I didn't share with you at the beginning is from a Stanford medicine perspective, there is a governance team that is populated by world experts that are virologists or epidemiologists, infectious disease physicians, and critical care docs and others. We belong to that group, and so are very engaged in those discussions. And so as things like the serology tests, for antibodies become rolled out, we will certainly not only be at the table, but we'll have access to many of those things as they evolve. I would just say it's still early in that evaluation process, but it's something that there's a lot of hard work and activity going on around.
Okay, I think those are the questions for Rick. We've had 2 other additional questions, and then Mayor, we probably should close this one down. We're running 15 minutes over. Has there been any incidents of any hate crimes? It says in Alameda, I'm assuming they mean Alameda County. Chief, do you have any reports of any hate crimes in Dublin as a result of the COVID-19 pandemic?
We have no reported hate crimes in Dublin during the last 3 weeks since the order's taken place.
And it's fair to say that you would not have that data for Alameda County because you're the chief of Dublin, and so you don't know what might be happening in other parts of the county where the sheriff's office has jurisdiction.
Right. We just have the crime statistics for the city of Dublin, and the other jurisdictions would have to report out independently.
Okay. And then there's a question, I believe it was answered early on in the call from Kimi, but is there any data for Alameda County on how many percent of those came in for testing are positive with COVID-19? Kimi did indicate on the beginning of the call that 6,750 people were tested in the Alameda County, and I believe we have 674 cases. So using that methodology, it's coming in at about 10%. Those are the questions we have, Mayor.
Ms. Smith, thank you very much, and thank you to all the panelists, Mr. Shumway from Valley Care, Stanford, and Kimi Watkins-Tartt for being with us today. And thank you to the members of the community who have attended and asked very insightful questions and been given some very comprehensive answers. Great job to all. This message has been recorded and can be referred to and forwarded on to others who want to hear the questions. Just to wrap up, I would say that number one, Alameda County is well prepared with the communication mechanisms in place, the hospital beds in place in case of a surge, the ventilators that are in place that are needed, and capacity to accept a surge, number one. Number two, there is surge help needed. If you have skills and can volunteer your time and in fact get paid for that time, go to our website and the COVID-19 place there on our website and volunteer your time. And lastly, it is critical that we remain vigilant, stay at home, stay safe, and save lives. This week, next week, and for the next month, and until the order is lifted, let's remain vigilant, flatten that curve. With that, we will also say that this concludes this first community conversation, but we have 2 more, one at 11:30 with our Dublin Unified School District Superintendent Dave Markin, and then one again later in the afternoon, 1 o'clock with our own Hazel Weatherford from Economic Development and the CEO of the Dublin Chamber of Commerce, Inga Houston, and other special guests in the economic space. So with that, everyone, thank you for joining. Have a great rest of the day.